20 PANCE Practice Questions, Cardiology, Angina. Hello, welcome to the Science Guide ASAP Learning. Today we are going to be practicing 20 PANCE Angina Practice Questions. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 1. Which of the following is a characteristic symptom of stable angina? Answer choices. A. Chest pain at rest. B. Chest pain that is triggered by exertion. C. Chest pain that is relieved by rest. D. Chest pain that radiates to the back. Answer. B. Chest pain that is triggered by exertion. Stable angina is typically characterized by chest pain or discomfort that is triggered by exertion or emotional stress and relieved by rest. Question 2. Which of the following medications is most commonly used to relieve acute angina symptoms? Answer choices. A. Aspirin. B. Nitroglycerin. C. Heparin. D. Warfarin. Answer. B. Nitroglycerin. Nitroglycerin is a potent vasodilator that is commonly used to relieve acute angina symptoms. Question 3. What is the most common cause of unstable angina? Answer choices. A. Coronary artery spasm. B. Coronary artery atherosclerosis. C. Coronary artery aneurysm. D. Coronary artery thrombosis. Answer. D. Coronary artery thrombosis. Unstable angina is usually caused by the rupture of an atherosclerotic plaque in a coronary artery, leading to the formation of a blood clot that partially or completely blocks blood flow to the heart. Question 4. Which of the following is a risk factor for developing angina? Answer choices. A. Smoking. B. High HDL cholesterol levels. C. Low blood pressure. D. Sedentary lifestyle. Answer. A. Smoking. Smoking is a major risk factor for the development of angina, as it damages the endothelium of the blood vessels and promotes the formation of atherosclerotic plaques. Question 5. Which of the following diagnostic tests is most commonly used to evaluate patients with suspected angina? Answer choices. A. Electrocardiography. ECG. B. Echocardiography. C. Magnetic resonance imaging. MRI. D. Computed tomography. CT scan. Answer. A. Electrocardiography. ECG. ECG is a simple and non-invasive test that is commonly used to evaluate patients with suspected angina. It can detect street segment changes and other ECG abnormalities that are suggestive of myocardial ischemia. Question 6. Which of the following medications is contraindicated in patients with a history of asthma or reactive airway disease? A. Metoprolol. B. Amlodipine. C. Nitroglycerin. D. Diltiazem. Answer. D. Diltiazem. Diltiazem is a calcium channel blocker that is contraindicated in patients with a history of asthma or reactive airway disease due to its potential to cause bronchospasm. Question 7. Which of the following is not a symptom of variant angina? A. Chest pain. B. Shortness of breath. C. Bradycardia. D. Street elevation on ECG. Answer. C. Bradycardia. Variant angina, also known as Prinzmetal's angina, is caused by coronary artery vasospasm and typically presents with chest pain, shortness of breath, and faint elevation on ECG. Bradycardia is not typically associated with this type of angina. Question 8. Which of the following is a common side effect of nitroglycerin? A. Hypertension. B. Hypoglycemia. C. Headache. D. Hyperkalemia. Answer. C. Headache. Nitroglycerin is a vasodilator commonly used to relieve angina symptoms. However, a common side effect of nitroglycerin is headache, which can be severe in some cases. Question 9. Which of the following imaging studies is the gold standard for diagnosing coronary artery disease? A. Echocardiogram. B. CT angiogram. C. Magnetic resonance angiography, MRA. D. Coronary angiogram. Answer. D. Coronary angiogram. A coronary angiogram is the gold standard for diagnosing coronary artery disease. This test involves injecting contrast dye into the coronary arteries and taking X-ray images to visualize any blockages or narrowing of the arteries. Question 10. Which of the following medications is a first-line treatment for stable angina? A. Aspirin. B. Nitroglycerin. C. Metoprolol. D. Heparin. Answer. C. Metoprolol. Beta blockers, such as metoprolol, are first-line treatments for stable angina. These medications help reduce the workload on the heart and improve blood flow to the heart muscle. Aspirin is also commonly used to prevent blood clots, but is not a first-line treatment for angina. Nitroglycerin is used for acute symptom relief, and heparin is typically used in the setting of an acute coronary syndrome. Question 11. What is the mechanism of action of nitroglycerin in the treatment of angina? A. Decreases preload. B. Decreases afterload. C. Decreases heart rate. D. Increases myocardial oxygen demand. Answer. A nitroglycerin decreases preload by dilating veins, which reduces the amount of blood returning to the heart and decreases the workload on the heart. This leads to a reduction in myocardial oxygen demand and relief of angina. Question 12. What is the most common cause of unstable angina? A. Plaque rupture. B. Coronary vasospasm. C. Cocaine use. D. Aortic stenosis. Answer. Unstable angina is typically caused by a sudden rupture of a previously stable atherosclerotic plaque, leading to platelet aggregation and thrombus formation that partially or completely obstructs blood flow through the affected coronary artery. Question 13. Which of the following is a characteristic of variant, Prince-Metal's, angina? A. Occurs at rest. B. Associated with physical exertion. C. Street segment elevation on electrocardiogram. D. Caused by atherosclerotic plaque rupture. Answer. C. Variant angina is caused by coronary artery vasospasm, which typically occurs at rest and is often associated with Saint segment elevation on electrocardiogram. Question 14. What is the recommended initial treatment for stable angina? A. Beta blockers. B. Calcium channel blockers. C. Nitrates. D. Aspirin. Answer. A. Beta blockers are the recommended initial treatment for stable angina because they reduce myocardial oxygen demand by decreasing heart rate, contractility, and blood pressure. Question 15. Which of the following is a contraindication to the use of nitroglycerin in the treatment of angina? A. Hypertension. B. Bradycardia. C. Erectile dysfunction. D. Concomitant use of sildenafil, Viagra. Answer. D. Concomitant use of sildenafil, Viagra, is a contraindication to the use of nitroglycerin because both drugs can cause vasodilation and severe hypotension, which can lead to cardiovascular collapse. Question 16. Which of the following medications is not used for the management of chronic stable angina? A. Beta blockers. B. Calcium channel blockers. C. Nitrates. D. Aspirin. E. All of the above are used for the management of chronic stable angina. Answer. D. Aspirin. Explanation. Aspirin is primarily used for its antiplatelet effect in patients with acute coronary syndrome or a history of myocardial infarction. Beta blockers, calcium channel blockers, and nitrates are all used for the management of chronic stable angina. Question 17. What is the most common cause of variant, Prince-Metal's, angina? A. Atherosclerosis. B. Coronary artery spasm. C. Physical exertion. D. Emotional stress. Answer. B. Coronary artery spasm. Explanation. Variant angina, also known as Prince-Metal's angina, is caused by coronary artery spasm, typically occurring at rest. Question 18. Which of the following electrocardiogram, ECG, findings is not typically seen in a patient with unstable angina? A. Saint segment depression. B. T-wave inversion. C. Street segment elevation. D. None of the above. Answer. C. Street segment elevation. Explanation. Street segment depression and T-wave inversion are typical ECG findings in patients with unstable angina. Saint segment elevation is a sign of myocardial infarction. Question 19. Which of the following diagnostic tests is most commonly used to evaluate for coronary artery disease in a patient with suspected angina? A. Echocardiography. B. Coronary angiography. C. Cardiac magnetic resonance imaging, MRI. D. Exercise stress test. Answer. D. Exercise stress test. Explanation. An exercise stress test is the initial diagnostic test of choice in patients with suspected angina. If the test is positive, then further testing such as coronary angiography may be indicated. Question 20. What is the primary goal of treatment in a patient with angina? A. To reduce the frequency and severity of angina episodes. B. To prevent myocardial infarction and death. C. To improve quality of life. D. All of the above. Answer. D. All of the above. Explanation. The primary goal of treatment in a patient with angina is to reduce the frequency and severity of angina episodes, prevent myocardial infarction and death, and improve quality of life. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.